to be talking about coronary artery bypass graft, and this presentation will be presented to you by Justin Martinez and Gabby Nunez. Here is our table of contents that you can go back to. We will first be talking about the pathophysiology, the prevalence, risk factors, medical management. Then we will be talking about the coronary artery bypass graft, and then the precautions, their impact, and of course, the occupational therapy considerations. So first, why would someone need a coronary artery bypass graft? So usually it is because they are diagnosed with coronary artery disease, and coronary artery disease is also known as CAD. It is a chronic inflammatory disease caused by the narrowing of coronary arteries, blocking oxygen supply to the heart. This decreases blood flow to the heart and then weakens the heart muscle and increases further risk for chest angina, also known as chest pain, myocardial infarction, which is known to many people as a heart attack, heart failure, and arrhythmias. And so, coronary artery disease is the most common cardiac-related disorder worldwide. It is the leading cause of death for both men and women in the United States. It impacts all racial and ethnic groups, and it is most commonly prevalent in ages 65 and up. So now we are moving on to risk factors. So genetic factors such as family history of immediate family members do increase risk for developing CAD. But in most cases, lifestyle factors play a bigger role in developing CAD. These factors include high cholesterol levels, the presence of diabetes mellitus, limited physical activity, smoking, and excessive alcohol consumption, as it can increase blood pressure and contribute to high cholesterol and weight gain. Stress and or the inability to manage stress is also a risk factor, as it increases cardiac workload, which then can cause unhealthy habits such as smoking or poor dietary choices. The medical management of CAD. So in the early stages of disease, management of risk factors are crucial. This includes controlling blood pressure, cholesterol, diabetes, controlling diet, weight, increasing your physical activity, learning to manage stress, and smoking cessation. Medication management includes aspirin or other blood thinners, beta blockers to slow the heart rate and decrease blood pressure, and nitroglycerin tablets to decrease chest angina, or also known as chest pain. Surgical management of CAD is most common in severely narrowed blocked arteries. Invasive procedures are done to alleviate chest pain, restore blood flow, and reduce risk of myocardial infarction. Two common surgeries include the angioplasty, which involves a stent placement to open the artery. Then there is the coronary artery bypass graft, which others may know it by cabbage. And then for the purpose of this presentation, we'll be going more in depth into the next slide. So a cabbage is performed in most severe cases, and the doctor will circumvent a blocked artery by using a healthy vessel from another part of the body, and the most common is found in the leg. And then risks that come with the procedure of a cabbage include bleeding during or after surgery, blood clots, infections, abnormal heart rhythms, failure of the graft, breathing problems, and also death. So let's talk cabbage precautions. Patients may develop chest angina, shortness of breath, and dysregulation of blood pressure weeks post-surgery due to the inflammatory response syndrome. Patients should check for infection. And also, patients will be discharged with advice on how to avoid sternal injury, As most traditional CABG surgeries are considered open heart surgeries, this leaves the sternum at risk of injury if not properly taken care of or using the correct body movement. Now, sternal precautions do vary depending on surgeon and rehab facility, but below are just some common suggestions. So, avoid pushing, pulling, or lifting more than 10 pounds. Avoid weight bearing with the arms. Avoid reaching behind the back. Refrain from twisting upper body for 6 to 12 weeks post-surgery. And then keep your move in the tube. This technique was developed to encourage mobility post-cardiac surgery. It encourages patients to keep their upper arms close to the body as if they are in a tube, to avoid any stress to the sternum during load-bearing movements.
A CABG can affect the body structures of the cardiovascular, immunological, and respiratory systems. These systems include the heart, which undergoes structural changes with the graft, enhancing blood flow. Blood vessels, as the grafted vein and/or artery becomes part of the coronary circulation for blood flow. And the lungs, which have potential temporary decreased function due to intubation and reduced mobility. The effect the CABG has on these body structures also has implications for cardiovascular system and respiratory system functions. These include increased cardiac output due to improved blood flow, improved stamina, endurance, and decreased chest pain, temporary pulmonary function inhibition, or in other words, problems breathing, blood pressure fluctuation as the heart begins to adjust to the improved circulation and new blood flow, and possible post-operative cognitive function or POCD, which can include memory inhibition, problems with attention, and other cognitive impairments. Coronary artery bypass graft, or CABG, can have significant effects on a patient's performance skills and daily occupations. First, motor skills may be affected. Patients often experience pain that impacts posture and stabilization, decreased coordination, and reduced endurance, making movement more challenging. Process skills can be impacted due to post-operative cognitive dysfunction, or POCD. This can cause difficulty with initiating tasks and sequencing activities in the correct order. Lastly, social interaction skills can also be impacted. Emotional stress, physical and cognitive fatigue, as well as post-operative anxiety or depression can lead to social withdrawal or reduced engagement in conversations and activities. Several areas of occupation can also be affected following a CABG. Activities of daily living, or ADLs, such as bathing, dressing, toileting, and grooming, may become difficult due to pain, limited range of motion, and reduced endurance. Instrumental activities of daily living, or IADLs, are also impacted. This includes driving restrictions, difficulty managing medications, and challenges with home management due to post-op physical limitations, which can all be concerns. Health management also becomes a major focus as lifestyle changes, including diet and exercise, are essential for long-term heart health. Rest and sleep can be disrupted due to pain and breathing difficulties, which can also affect the patient's overall recovery. Education may be affected as cognitive challenges and fatigue can make it harder and more difficult to focus on schoolwork or retain new information. Work can be impacted as physical restrictions may delay a return to work or even lead to career changes for some individuals. Lastly, social participation may decrease. Fatigue, pain, and the need for physical support from others can lead to social withdrawal or strained relationships that are pre-existing. Lastly, We'll discuss the key considerations when performing an occupational therapy evaluation for a client post-CABG. First, we begin with understanding the client's occupational profile. We need to identify the client's goals, such as what do they want to achieve during recovery? What roles did the client have prior to surgery? Were they a worker, student, partner, or caregiver? We also need to assess the client has support systems and what recovery considerations should be taken into account. This includes evaluating the home setup to ensure safety and comfort during the recovery period. Additionally, lifestyle factors such as smoking habits, diet, and stress management should also be addressed as they can influence both recovery and long-term health outcomes. Next, OTs would also need to evaluate the client's performance skills and client factors. For motor skills, pain levels, particularly when performing daily tasks, should be assessed. It's also important to consider any physical safety precautions that might be necessary, such as movement restrictions and/or sternal precautions. It is also important to assess cardiopulmonary function, including endurance and oxygen levels, to determine what activities are safe. It's also important to evaluate cognitive and psychological factors like post-operative cognitive dysfunction, or POCD, depression, or anxiety, as these can all affect attention, memory, and mood, all of which impact recovery. Additionally, evaluating social support and social participation is crucial to understand how these factors may affect the client's engagement in daily activities. It is also important to examine occupational performance. For ADLs, it's important to look at activities such as dressing, bathing, and toileting, especially since these may be impacted by pain, range of motion limitations, and/or fatigue. For IADLs, we also need to address certain tasks such as home management, driving, and medication management. This would also be the time to evaluate the client's readiness to return to work or school and/or to determine if any modifications are necessary for those things to happen. Last, we must also examine the social participation in terms of what activities the client wants to return to and what their current level of engagement is. This can help us understand if they are withdrawing socially or need support to re-engage in their community or family life. In order to do all of this, there are some assessments that we might want to consider. The Montreal Cognitive Assessment, or MoCA, is helpful for evaluating cognitive function. The Modified Barthel Index, or MBI, helps assess the client's independence in ADLs. The Board Rating of Perceived Exertion, or RPE, measures the client's endurance and exertion levels. These assessments, along with others as necessary, will guide the development of a comprehensive intervention plan tailored to the client's needs.